I'm Dr. Darshani Hettiarachchi, consultant child and adolescent psychiatrist, currently working at Teaching Hospital, Karapitiya. Can you all hear me clearly? Can
We do, madam. We do. Yes.
Okay. So during this, so today I will be discussing about the psychological support which can be given for children during COVID-19 pandemic. So basically, this presentation will be very basic. Actually, I'm not going to focus on any advanced technical psychological theories and all. This is basically how we can support children in the community and also in the hospital setting during this COVID-19 pandemic. So during the first half of the presentation, I will be focusing on how this COVID-19 has impacted on children in general, mainly the children who are in the community. And during the second half of my presentation, I will be discussing about how we can support children in the hospital setting. So let's see what are the impacts of COVID-19 on children. As we all aware, limited social interactions is the main obstacle, main difficulty the children are facing today due to COVID-19, that schools are closed, all the extracurricular activities have been suspended, they are confined to home, they are having very limited contacts with peers and teachers, and also very restricted, dull kind of daily routine. So all these things have significantly affected their social interactions. In later slides, I will be discussing how these limited social interactions can affect their psychological well-being. And then disease-related factors, obviously, if a family member get infected, or if the child, him or herself get infected, or if they have to get quarantine, or if they have to go through the investigations for COVID-19, all these things can affect their psychological well-being, and especially the stigma, social stigma attached to this. If you can remember, during the second wave, there were so many unethical kind of media release, like in the media they were discussed about how some school children's families were affected, and they showed some unethical pictures. So I have as a child psychiatrist working at Gaul, I have personally experienced the psychological trauma those children, specifically a school from Ambalangwada, how these children were traumatized during these this period. So, and then the online education and related factors. And as we all aware, there's economic and financial difficulties. All the people in the world are like all the people are affected due to the economic and financial difficulties. So this can definitely impact on children as well. And during this period, we have seen the mental health issues have been increased in children, like fear, sense of uncertainty, excessive worries, anxiety, depression, and also increasing the pre-existing mental health issues. So children who are already having mental health issues are more vulnerable in getting more psychological consequences, and also increased victimization of child maltreatment, and also increased exposure to domestic violence. As we all aware, parents or adults are very stressed out during this period. They are unable to go to work, financial difficulties, increased substance use, and a lot of conflicts, arguments within families. They also have difficulties in having access to external support. So all these things have led to increase in domestic violence, and this children are more and more getting exposed to domestic violence. So first, let's see how these limited social interactions can affect child's psychological well-being. Limited social interactions can affect a child at any age. So young children, very young children, uh, they can have poor environmental stimulation, where actually almost all the children are stuck in the home environment. They are unable to go to nurseries. So most of these children get their, pediatric registrars, you might be knowing that children at this toddlers, they need environmental stimulation, multisensory stimulation for their better cognitive development. So when they are, most of these stimulation they get through the nursery education. So once they are stuck at home, they are not getting this stimulation, which can affect their early child development and cognitive stimulation, cognitive development. And quite a little bit older children and adolescents, they always build up their social skills, improve their most of their skills through peer relationships. So it's very important for older children and adolescents to have uh, friendships or relationships. So they should associate with children at their age to build up proper social skills, communication skills, and how to respect others, how to respect other people's views, developing the skills of sympathy, empathy, organization skills, anger control, emotional regulation. All these things are developed through friendships or peer relationships. So I think you will be able to understand how these children will be affected if when they are having very limited social interactions. And also, if this condition persists for longer period, definitely these children will have significant impairments in their interpersonal relationships and personality development in long run. So those are some aspects of some consequences of limited social interactions. However, there are many more. I'm not going to discuss each and everything due to the limited time factor. And let's see what are the impacts of online education. As we all aware, uh, these days, online education is the only source of education for children. Uh, so, what are the main difficulties they are facing with online education? First thing is, some children find it difficulty in understanding the subject matter concepts, because it's very hard for teachers to teach through online, and also children find it difficult to understand most of the time, and also technical difficulties like poor internet coverage and also expenses for internet. And children, like they always want to play, talk with others, always need to interact with others. So you can imagine how they will get bored, and when they always stuck to the computer and studying rather than having chat, talking with friends, moving around, or they are missing all these social interactions, friendships, happiness, everything which they gain usually during school time. So boredom and decreased interest towards studies. I have seen so many children complain of lack of interest towards studies during this period. And also, I think you may aware better than me about this. The most of the pediatricians complain that due to the children are getting very limited physical exercises. Because of that, they are having more and more increased risk of the metabolic. They are getting more and more metabolic risk. So they're talking about, they're worried about this increased metabolic risk among children due to limited physical exercises. And also I have seen many children, they overeat during this period, and as I mentioned, limited interactions with peers. And this is the biggest problem which I have seen. I think you may also aware about it, the internet addiction. So I have seen so many children, and this is becoming a huge problem in our society, in children, because they are getting addicted to the internet due to this online education programs, because most of the time they have to stay in the internet. And sometimes I have seen teachers, not that I'm trying to put blame on anyone, but sometimes some parents come and complain that children, they are waiting in online, but teachers are not coming on time so that they get unnecessary access to uh, undesirable or unacceptable websites kind of problems. So internet addiction is becoming a huge problem in our country. So what is, I think you all as a pediatric registrar, so even as parents, because most of you may be having children at home, so I think we all have to be mindful about this condition. It's very important for all of us to be aware about this condition. So what is internet addiction? Internet addiction is excessive use of internet that makes the internet more important than studies, family, friends, and daily or routine work of children. And this is a compulsive behavior that completely dominates the child's life. So he will not be interested in any other work. So the child will only get engaged with the internet. What are the main reasons for it? One thing is obviously the online education and also some social network. Some children they make groups and try to log into internet and they try to play all kind of things and to relieve unpleasant feelings and boredom. I think this I discussed earlier. And easy accessibility to knowledge and also poor adult supervision. This is the most important thing that I want to highlight, because most of these children, especially children of us, the care workers children, because since we have to go to work even during the lockdown period, our children are stuck at home. They are getting involved, they are learning through the online, and there's no, most of the time there is no one to supervise them, so they can easily get addicted to internet. They can get easily log into undesirable, unacceptable websites and playing, and they can easily be put themselves into trouble. So that is something which I want to highlight. So everybody have to be very vigilant that adult supervision is very important in this regard. So what are the features of internet addiction? Compulsive use of internet and failed attempt to control this behavior. Sometimes they try to control, but still they are unable to control the behavior. And less interaction with family and friends, because they always want to be in the internet. They don't want to interact with other family members or friends. And neglecting sleep to stay online. I have seen many children who are staying awake throughout the night and go to sleep in the morning. So this sleep wake cycle has been completely disturbed due to this. And poor appetite and obviously deterioration of school performance and anger irritability when internet is disconnected. And also most of the time they are secretive about time spent on internet. So these are some features of internet addiction. And let's see what are the harmful effects of internet addiction among children. It can have significant impact on their physical health. Limited exercises, weight gain, increased metabolic risk, and victimization of sexual abuse online, which we have seen many times, and cyberbullying. And limited social interactions, because they always want to get engaged through the online, so they don't want to talk with other people. So their communication skills, their social skills, their interactions all will be impaired. And the other most important and very dangerous thing is the online game addiction disorder. So they can get addicted to online games, which is very dangerous. Once I saw in Gaul, there were 11 children. I wonder whether you may have heard about that game called Blue Whales. I think now it's been banned. However, at the end of the day, at the end of the game, that they are asking the child to commit suicide. So these 11 children, they have been repeatedly playing this game for a longer period, and now they have come to a stage that they wanted to commit suicide. So those kind of things can happen. So it's very important for everyone to, not as doctors, but even as adults, we all should be aware about the consequences, harmful consequences of this internet addiction. And poor sleep and sleep disorders. Internet addiction, studies have shown internet addiction can result in impaired attention, concentration, memory, conceptualization in children, and also it can result in cognitive impairment. All these things can lead to deterioration of school performance, and also it can affect the long-term personality development, such as self-esteem. It can have adverse effects on self-esteem, self-confidence, social skills, and also increased risk of mental health issues like anxiety and depression. So, how are we going to manage it? You may aware that most of the child psychiatric conditions we usually go with behavioral psychological management, and medications will be the last resort. So for internet addiction also we always talk about behavioral and psychological management. So these are the management principles. First thing, I think as adults we should be aware about this, that this is happening within our children. So we have to be very vigilant and always keep an eye on there while they are on internet. So pre-internet training, that is to set boundaries and educate about unhealthy sites, because most of the time children go to these unhealthy sites, so uh, they start spending more and more time in the internet, that they are not aware about the bad consequences of internet addiction. So it is very important to set them boundaries. That is very important. There should be boundaries, and also it's important to educate the children about the harmful consequences. And then the monitoring and supervision. It's always adults should monitor and supervise children. And also don't make internet as an entertainment media or recreational purpose, because what I have seen most of the time, parents see internet as an recreational or entertaining media for children. Because I think you may also have experienced this in the pediatric wards, because I have seen so many parents most of the time when they are feeding their children, they give the smartphone and just feed the child. So it's a very common habit which I have seen. I think we better do a survey about it. How many parents are practicing this? So it's like always parents are trying to introduce this as an entertainment. So it has to be stopped. Internet should be used only for education purposes. And also then it's important to make a routine. A child should use the internet only for studies from this time to this time, and after that they are not allowed to use the internet, and setting limits, it's a must. And also now we are talking about limiting internet use. However, at the beginning I explained that children are bored at home. They are having very limited social interactions, limited extracurricular activities, very restricted routine. So they are bored. They are frustrated at home. So it is important as parents to spend more time with child. I think it will be very difficult for us as healthcare workers to spend more time with children during this COVID pandemic time. But still, it's very important to try our best to try at least half an hour per day to spend with the child. But again, it's very important to spend time with child and understand their concerns. And also introduce alternative pleasurable activities. So, because whenever we deal with children, if we say no to something, then we should give alternative for that. So if we are going to say no, you are not going to use internet, then at the same time we have to introduce some other pleasurable activities for them. For example, music, dancing, cooking, drawing, whatever, anything which makes any harmless thing which make child pleasurable, then you have to identify them, you have to discuss with the child, and you have to facilitate it, and you have to give the child opportunity to try these other pleasurable activities instead of internet. So those are the main principles of managing internet addiction. Mainly it's the monitoring, supervision, limit setting and education. So I mentioned about child maltreatment. So uh, these days, I think the victimization of child maltreatment is getting increased. However, unfortunately, I believe most of these are underreported because in my clinic at Karapitiya, I used to see uh, nearly 80 to 100 per, not 100, nearly 6 to 80 per month. But however, now I rarely see a victim of child abuse. Not that they are not happening. I think most of these child abuse incidents are underreported during this period. So I think most of you are aware that most of the majority of the child abuse are happening in the familiar environments, and also most of the perpetrators are known people. So just imagine during this period, children are stuck with these known perpetrators in the familiar environment. So I believe they are getting more and more abuse during this period. So, what are the reasons or risk factors for child maltreatment during this period? Uh, as I mentioned, increased time spent with and exposure to their abusers, and stressors at home. The economic uncertainty, losing jobs, loss of income, or these parents are also frustrated. So, increased substance use, all these things are happening. Some parents are also frustrated, stressed. So, their stress can be deviated to, or they may put their stress onto children. So physical and emotional abuse may be more common during this period, and limited or no access to protective support networks like family relatives, because they are confined to their home or one place, so they are unable to get support from their protective or supportive figures, especially school teachers, because I have seen so many times where children have reported their victimizations to school teachers. So now they are not having access to school teachers, which is quite unfortunate, so that teachers are unable to detect these things which are happening in the home environment. And also the formal like protection services hotlines, they are also not functioning to the maximum level. And increased consumption of alcohol and other substances, and due to this online education and all, increased risk of online abuse is also happening these days. And some children, we saw so many information about children in media, that some children, I think once one child committed suicide, once that child's mother was taken to the hospital and child was left at home. So when children have to stay away from parents due to the illness or the process of quarantine, they are more vulnerable to be abused. So let's see how a child responds to a crisis situation. There are many factors which determine how children respond to a crisis situation. So one is their previous experience or their prior exposure to crisis situation, and also their physical and mental health issues. If a child is already having a physical illness or a mental health issue, then they are they are less resilient, or their coping strategies will be less, so they may be more vulnerable. And the cultural background, some children are more resilient according to their culture, some children are less resilient. And socio-economic background of the family also affect how children respond to crisis situation. So there are very limited data about the mental health issues in children during COVID-19 pandemic, but there are few studies. The recent study conducted in China on children and adolescents reported that increased level of anxiety, depression, distraction, irritability, and fear that family members would get the condition, and more common, have been found to be increased during this period. And also substance use, increased substance use among adolescents as a method of self-medication. But I don't think in our part of the world, like in our country, that we are not seeing much increased substance use among adolescents during this period, mainly because they do not have access, they are not unable to go out. However, this is in other countries. So these conditions have been increased, and also in a survey done in April by UNICEF, April 2020 by UNICEF, they have studied 1,700 children and adolescents from 104 countries to understand how the COVID-19 pandemic was affecting their lives, especially the mental health and the psychological well-being, and the children and adolescents reported high level of stress. So, as I mentioned, during these days, we see increased mental health issues in children, fear, sense of uncertainty. The biggest thing is the sense of uncertainty. Especially, I see this in children of healthcare workers because they are very worried about their parents, whether their parents get infected. So, this sense of uncertainty, if their parents get infected, what will happen to them, whether they will have to go to the hospital, whether they will be left at home alone, all these worries are with them. So excessive worries, and sometimes children presenting with behavioral disturbances and anger, irritability, poor anger control and hyperactivity. I think you may have seen so many children with multiple somatic symptoms during this period, because I am getting so many referrals from pediatric team with multiple somatic symptoms during this period, and anxiety, depression, and also increase pre-existing mental health issues. So how we can identify a child when a child is in a distress? So these are some features which alarm us that this child is not doing psychologically okay, or the child is in a psychological distress. So children may have difficulties in sleep and eating, and they may experience nightmares. Sometimes they may be withdrawn or aggressive. As I mentioned earlier, they may complain of tummy pain, headache, like multiple unexplained physical symptoms. They may have fears, being afraid to be left alone, and also clinging, depending behaviors like regression, we say sometimes, like they try to cling to an adult, they don't want to be separated from adults. And new fears, the children who are not scared for something, they develop fears to those again. Like for example, is darkness. Some children, a child who is not afraid to go out in the dark will develop fear to go out during the dark. Decrease interest in playing and engage in playful activities, and being sad, crying more than usual, and for no reason. So how can we support them? This is mainly in the community level. So how can we support? First thing is to talk to them. It is very, very important to talk to children and try to understand what is going on. And it is also very important to explain them about the COVID-19 pandemic and the current situation in a way they can understand, like age appropriate simple explanation. It is very important, and we always advise parents to limit watching TV programs regarding COVID-19, limit it to half an hour, maximum half an hour per day, and also try to avoid showing scary sceneries in TV related to COVID-19. And then let them express and communicate their feelings in a safe and supportive environment. No matter how emotionally disturbed you are, it is very important that whenever you talk to your child, you have to be very calm and approach the child in a supportive manner. That is why we always tell that as adults, we have to look after our psychological well-being, because if we are not worried, or if we are psychologically stable only, we can support our children. And in case of in where the family have to be quarantined or the parents are infected and they have to be hospitalized, so keep children close to their parents and avoid separating children and their caregivers as much as possible. It is very important because separating the children from their attachment figure or their safety supportive figure can have significant psychological impact on them, even like in long run. So ensure, if in case of an separation, it's very important to ensure regular contacts with parents and caregivers during the period. For example, for phone calls, video calls, daily kind of stuff. And in the family environment, in the home environment, it's very important to maintain a familiar routine in daily life. And as I mentioned earlier, the children are bored, they are frustrated, they are not having enough pleasurable activities. So it's very important to provide them with age-appropriate pleasurable activities and also help them to find positive ways to express feelings such as fear and sadness. For example, if a child is worried and if the child is sad, sometimes children can become aggressive. They may try to break some household stuff. So we can encourage them to find positive ways. For example, if the child is feeling sad, we can encourage them to write a small poem, or they can write a few sentences how he feels, or we can encourage them to draw a small picture. So the kind of positive ways to express their feelings rather than expressing it in a negative way. So those are the parenting tips given by the UNICEF. Always be positive and spend quality time with the child, which I mentioned earlier, that try to spend at least half an hour with the child. During that time, always try to understand the child, keep the child happy, try to understand the child's worries and try to help the child to come out of those worries, and have a structured daily routine at home, and also honesty and openness when giving information about the COVID-19. However, it has to be age appropriate. And now let's move on to the area where how we can support a child in the hospital setting. So even though this presentation is focusing on supporting children during COVID-19, this part of the presentation, I will be explaining how you can support children, any child in the hospital setting. So this is a general approach rather than just for children who are positive for COVID-19. So let's see, how does a hospitalized child would feel? So first thing, they will feel separation anxiety because they are staying away from the family, and pain. Depending on the condition they are having, they may feel pain and fear about himself, herself, or family. Especially in this condition, they may be worried about their family. Whether the family also get infected, kind of worries, and also uncertainty. Once they get admitted to the hospital, they always worry what is going to happen next. So what will happen? So this sense of uncertainty, they will always feel this sense of uncertainty and loss of control, because in the hospital setup, their normal routine, daily routine is completely disturbed. Restrained movements like and sleep, feed, everything is decided by the hospital staff. So they are having very limited control over their activities. And sometimes children feel angry why they were admitted. Sometimes they feel frustration that they, especially when children, I have seen so many children who have to get admitted repeatedly. For example, children with thalassemia, children with nephrotic syndrome, all these children, I think they always have this frustration. Why I have to get admitted? They always have this anger. Why should I get admitted? Sometimes children also can have the feeling of guilt, because sometimes they may think that I have done something wrong, that is why I have to get admitted. all these feelings will depend on their age, developmental stage, their temperament, all these factors. But children can, depending on multiple factors, they can feel things differently and feeling both. How do parents feel? They believe they are to be blamed for child's condition, especially when it comes to COVID-19. I think most of the time children are staying inside the home. So whenever a child gets infected, I think parents may feel guilty that they are the people who brought the illness to the home. So, and also they are helpless. They do not have any control about, like they can't do anything. Now the child is ill, so they must be feeling helpless and anxiety and loss of control. So, what are the factors which can affect the child's reaction to hospitalization? As I mentioned earlier, child's age and intelligence level, amount of preparation. Like if a child is getting admitted abruptly or suddenly, or if the child is coming for unplanned surgery, then the child's reaction may be different. And security of home environment. If a child is coming from a very disturbed, disruptive, abusive home environment, sometimes child feels more safe in the hospital environment. Uh, I have seen so many children sometimes after sending to me, because after coming to the pediatric ward, staying there for a couple of days, now very settled in the ward, refusing to go back to home. So those kind of things, that's level of security the child feels in the home environment, and previous experience about the previous hospitalizations. If the child has been admitted previously and has had traumatic experiences, then child may feel scared or anxious to get admitted next time. And support from the family and medical person. If the child is getting good support from the family as well as from the medical persons, then child will be happy in the hospital and he will not be in a distress once admitted to the hospital. And also child's individual emotional health and coping skills. We all aware that children can have different emotional skills like temperament. Some children are very anxious, some are not anxious at all. So different kind of emotions children are having. So depending on their emotional health and the coping skills, child may react in a different way. Let's see what are the emotional and behavioral symptoms seen in an ill child. So when a child become ill, they can show internalizing behaviors or externalizing behaviors. I think if you go back and think about your ward experiences, you may have seen so many children with internalizing behaviors as well as externalizing behaviors. So, internalizing behaviors are negative behaviors that are focused inward, like towards them, like somatic symptoms, fearfulness, anxiety, depression, withdrawal, phobias. So, the other negative behaviors are focused towards them, inside. Externalizing behaviors are negative behaviors directed outwards towards others. For example, defiance, hyperactivity, disruptive behaviors, aggression, those things are externalizing behaviors. But remember, these are not child psychiatric conditions or diseases. These are just behaviors children show during a stressful situation. What are the reasons for internalizing and externalizing behaviors in a hospitalized child? As I mentioned earlier, this part of the presentation I will be focusing about children in general, who when how we can support when they get admitted. So this is not only for children who are getting positive for COVID-19. So when a child feels the perceived lack of control over the illness and its symptoms, for example, epilepsy, sickle cell disease, and when a child is having frightening symptoms, in case of asthma, epilepsy, child is so frightened and then they can develop internalizing or externalizing behaviors. Restrictions in positive activities due to hospitalization, and peer rejection in sometimes when a child is having a visible abnormality and then child is being like a cleft lip, palate, any deformity, and then the child is being rejected. This sense of rejection can lead to internalizing or externalizing behavior. And also side effects of the therapies. radiotherapy, chemotherapy, or even the medications, the pharmacological medications side effects can lead to internalizing, externalizing behaviors. When the physical illness affects brain function and the associated behavioral regulation. Example, in case of epilepsy, they can have different behavioral changes. And also may be a response to illness related frustration. I mentioned earlier that I have seen many children with thalassemia and nephrotic syndrome that they show a lot of behavioral disturbances due to illness related frustration. In addition, symptoms of the physical illness such as pain may lead to elevated scores of somatic complaints, internalizing problems in children. Now let's see, like I think I do not have to explain this to you. Like you may have seen so many children since you're working in the pediatric wards, like children, the response of the children to the same thing will be different. Like two children would respond to the same thing in a different way. So you may have seen many children responding to the same thing in multiple ways. So what are the reasons for this? This we can understand through this biopsychosocial approach. The child's response to the physical health or the physical illness is determined by multiple factors, mainly psychosocial. The biological factors, psychological factors, and social factors. So all these factors can work together. They all get integrated and they all act together to determine how the child would respond to an illness. So biological factors, gender. Sometimes girls may be more worried, or the physical illness, if the child is already having a physical illness or disability, genetic vulnerability, immune function, neurochemistry, stress reactivity, medication effects, all these things can affect. Psychological factors, learning, memory, attitudes, beliefs, the personality, actually the temperament of the child, behaviors, emotions, coping skills, past trauma, all these factors can affect. They all can affect the child's response, and the social factors like the amount of social support the child is getting, family background, cultural aspects, social economic status, education, all these factors can affect how the child is going to respond to an illness. So, how to manage? This is how, when a child is psychologically disturbed in the ward, how we can support the child. First thing, I think we need to reassure both child and the parent, because not that I am trying to find fault or with anyone, but I have seen many referrals where that I'm getting many referrals from pediatric wards, like child is having multiple somatic complaints, and that all the physical investigations are normal. Now they're sending the child and the father or the parent to me, but all the investigations have been done, EEG, CT, everything is normal. The thing is, but they were not told, even the parent was not told that these investigations are normal. So at the pediatric board, they have not done the reassuring part. So I think it's very important that it's always very important to reassure the child and also the parent uh, about the condition, about the procedures, and about the medications, about the plan, everything. And also to explain the condition in simple, understandable way. Because most of the time as doctors, we tend to use medical terms when explaining to parents. But we assume that they have the capacity to understand what we are saying. And sometimes we tend to assume that they know to the extent what we know. So whenever you try to explain something to the parents and also children, it's very, very important to explain in a very, very simple manner. And also it's very important always to tell them the plan, that how many days, that you may not be able to give an exact plan, however still you can say that this will take this much of days. Like obviously if you start IV antibiotic to a child, you know that at minimum you're going to give it to 5 days or 7 days, so that you can explain it that you will have to stay in the hospital for maybe 4 or 5 days. So then only, because you are not, after you start an IV antibiotic, you're obviously knowing that the child is not going to be discharged in the very next day. So those things are very practical points that it's very important to, during your ward round, just explain that you may have to stay in the hospital for few more days. Then the child and the parent will be able to make their mind and try to make the ward environment more child friendly manner, and adequate pain management. Mm, This is also very important. Explain about the medical procedures in advance, because sometimes I have seen like some the nursing staff, they just come without explaining anything. Ababata then just give the injection. So they get so frightened. Next time when that nurse comes to the cubicle, this child try to run away because child is worried that the nurse is going to give the injection again. So it's very important to come and explain that you need an injection. It will create a slight pain, but this pain will go in few minutes time. So, and to get recovered from this condition, you need to have this injection. In that way, if you explain the child in a kind manner, the way child can understand, child will understand. But still there can be exceptions. Some children are having injection phobias, those kind of things. But most of the time, by explaining the child about the procedure, you will be able to minimize these difficult situations. So let's see, what is this challenging behaviors? Difficult problem behaviors put the safety of the child and others at risk. It can have a significant impact on the child's life and others. So what are the challenging behaviors? I think you may have seen, you may have experienced these things many times. Aggression. Sometimes when a child is going to get, when we try to give an injection, child will become aggressive, hitting, kicking, biting, distraction, trying to run away. And sometimes children can try self-injurious behaviors like head banging, biting themselves, picking their skin, and temper tantrums. Uh, Trying to sleep on the floor and hitting the head on the floor, and absconding, running away, and eating inedible objects. These are some problematic behaviors or challenging behaviors which we see in the ward setting. So again, what are the reasons for challenging behaviors? What I want to highlight here is that most of the time when a child in the pediatric ward shows a challenging behavior, the, the the medical staff tend to believe that this is due to a psychiatric condition. So they always try to do a psychiatric referral before trying to practice basic principles, basic behavioral strategies which can be used in the ward setting. So if I think that this slide is very important for everyone to know. So what are the main reasons for challenging behaviors? One is fear, anxiety, worries about the condition, worries about the family, and illness-related factors, maybe pain, maybe feeling unwell, and medication side effects even. Some medications can result in irritability, anxiety, and medical procedures like IV lines, injections, bitter taste of medications, and hormonal changes can lead to aggression during puberty, and frustration at being told off, not being listened to, not being understood. So these are the main reasons for challenging behaviors in children in pediatric wards, not due to child psychiatric conditions. So this is what I think you will have to be mindful. Whenever a child gets a challenging or difficult behavior, first try to use some basic principles and try to calm the child down and try to understand what is the reason for this child's behavior, and please try to put the child psychiatric condition to a last differential diagnosis, right? So reasons for challenging behaviors, again, feeling upset or distress about something, perhaps a change in routine, even loneliness, boredom, lack of stimulation in the ward, and sensory needs. Sometimes children do these behaviors only for seeking attention. This is also, we say, common, not commonly, but I have seen many children, they like when they are attached to one nursing staff or a medical officer, and when this medical officer or the nursing staff try to go and help another child or try to do something with another child, these children can get worried, upset. They want the whole attention of this medical officer or the nursing officer for him. Then they will start disruptive behavior, kind of attention seeking behaviors. These are also we see in children, and they are not due to psychiatric condition. And also fear of where they are or what they are doing. So how we approach, that is why I said before referring the child to the child psychiatry unit, those things you can practice in your ward setting. First thing is to assess the behavior. Then you will be able to identify why the child is showing this behavior. If you observe this behavior, child may have a pattern. For example, as I mentioned in the earlier, if the child is having an attention seeking behavior, that the child is seeking all the attention from one particular identified nursing staff or a medical officer, then immediate you will observe that child will start showing disturbed behavior whenever the staff is trying to support another child. So then you can identify that this is the reason for child's disturbed behavior. And then indirect approach, history about the behavior, when, where and why. So it's very important when this was started, where and why. So if you can find the answers for these questions, you will be able to address these and settle the problem within the ward. And direct approach, observe the behavior, and we also have the ABC chart, or we call it a behavioral analysis. That is, in the behavioral analysis, what we do, we maintain a chart, ABC chart, where we record antecedent, behavior, and consequences. Where we record. This can be done even by a nursing staff. So the behavior, you write the behavior and then you check what was the preceding event, what resulted in this behavior, and then the consequences. Again, for example, the same when the child was having attention behavior, disruptive behavior, and trying to get the attention from the nursing staff. So the behavior would be the child is trying to hitting his head on somewhere, trying to hurt himself. And the antecedent, what has happened before that, maybe the nursing staff has tried to support another child. And the consequence, if the nursing staff comes and cuddle this child and the behavior settle. So now you know the pattern of behavior. So most of the time, by using this antecedent behavior and consequences chart or the behavioral analysis, you'll be able to identify the pattern of behavior. And if a child gets disturbed in the ward, again, first thing is you need to emphasize the child's safety and non-pharmacological strategies. Remember, pharmacological management is the least option, or we should use the pharmacological management as the last resort, because I am getting many in the nights, I am getting many phone calls from pediatric wards. I have got many calls from pediatric wards that when child refuse to take medications, for example, if the medication is having bitter taste, child may refuse to get the medication. And when the staff is trying to give the medication forcefully, child may try to run away from the ward. So for that incident, how can I give a medication to sedate the child? It's always the behavioral management. Just imagine, if in our home setting, if our child tries to break something or showing some temper tantrum, would we give some medication and put that child to sleep? No, we are not doing that. We try our best to console the child, settle the child with behavioral management. So I think it's the same in the hospital setting, ward setting also. So pharmacological management to control the disturbed behaviors in children comes as the last option. And if pharmacological treatment is required, stepwise approach. Always first try to calm the child, educate the child, reassure the child, keep the child in a safe environment. At the same time, it's important to assure the safety of the staff as well. But still, it's always a non-pharmacological and behavioral approach is the first management approach. And physical restraint is the last resort and should only be used to facilitate rapidly effective pharma. So as I said, this physical restraining and pharmacological management is the last option. And if you want to restrain a child, then it should be done only to facilitate a rapidly effective pharmacological treatment. So this is the stepwise approach. Mainly verbally try to console the child, get a child to a safe place, try to understand what is going with the child, explain the child, reassure the child, try to understand and try to get what is going on in the child from him, and get the parent involvement, and then the stepwise approach. And also sometimes in the ward there may be some staff the child is having more attachment with, so you can use that staff member to settle the child. Then stepwise approach. So first you try to console or settle the child verbally, and if it's difficult, then only you go for pharmacological management. Pharmacological again, first you go with oral medication and then with the IM medication. But I always recommend to not to go for pharmacological management. Try your best to manage with behavioral management. And if you, in case if you have to give pharmacological management, then post sedation monitoring, and then try to understand the reason and prevent further incidences like it, and then debrief the child and to document. So alternative means of calming a child, again crisis prevention, anticipate and identify irritable behavior. So if you can identify the child's irritable behaviors, because all these disruptive irritable, most of the time these irritability disruptive behaviors we see in children who are getting admitted to the hospital uh, repeatedly. So then you may have better understanding about the child's behavior, past history. Then you will be able to anticipate the behaviors. And especially it comes to COVID-19. Most of the children, if we have separated the child from the parents, if the child is in a very distressed mode, then we have to anticipate that child may show some irritable or disruptive behaviors. And again, you can, if a parent or a caregiver is available, you will be able to get the collateral information about child's behaviors and child's temperament at home. So then you will be able to understand how you will be able to anticipate. And it's also important to, I think I have been repeatedly explaining the safe containing environment, and listen and talk simply in a calm manner, and often plan and offer planned collaborative sedation, and that is the last option. So it comes to the end of my presentation.